name is Anna Pepper. I'm a registered nurse here at Cole Memorial working in the maternity and labor and delivery postpartum unit. Today we're going to be doing a newborn bath demonstration. This video can be used for brand new parents who've never given a bath before, or for more experienced parents who need a quick refresher and were not there for their baby's first bath. So we're going to get started. First thing you would want to do before your newborn bath is, of course, don your gloves, obtain a vital set on your baby, and make sure their temperature is stable. Normally we do our newborn baths underneath the warmer so the baby is comfortable and the temperature is maintained while they're being uncovered. The things you'll need for your newborn bath are small amounts of baby safe soap, lotion, fresh towels and washcloths, a soft bristled toothbrush to wash the hair, a cord clamp remover, and your clean clothes for after the bath. One thing we like to tell parents is that it's okay to put your baby's towels and post-bath clothing and hats in the dryer, or we keep them in the warmer. That way when your baby is done with their bath, they're kept nice and warm and safe and cuddled. But it's important to ensure that the clothing coming out of a dryer or warmer is not too hot so it doesn't burn the baby's skin. So the first step we're gonna do is to wash the face and eyes with a clean washcloth with no soap on it, making sure your water is nice and warm, but not too hot or not too cold. We're gonna wash from inner to outer canthus, just as you would an adult. Using a separate portion of the washcloth, we're washing the cheeks, forehead, nose, under the chin, and inside and around the ears, making sure to get each crease, ensuring there's no debris left. You would then use a smaller towel or dry washcloth to pat dry the areas you just washed. Next, we're going to move down to the upper extremities. Here you will use a small amount of baby safe soap on your washcloth, washing just as you would an adult down the arms, around the hands and in between the fingers, along the upper chest, and along the other side. Again, rinsing and drying just the same way you did the face. Some reasons we would not perform a newborn bath are if the baby is attached to an IV for any reason, has any continuous cardiac or pulse oximetry monitoring, if the baby is maintaining glucose checks, unless their glucose is stable, if they're receiving IV glucose for any reason, you would not do a bath, or if the baby is not maintaining their temperatures and has to be placed under a warmer frequently. Now is the time when the nurse may remove the baby's umbilical cord clamp with this little machine. It safely and effectively removes the clamp, just like that. Your baby's cord should now be drying and may appear plastic-like, and that is normal. Next, we're going to move to the lower extremity. Again, using a small amount of soapy water, washing along each leg, the feet and the toes, rinsing and drying in the same manner you've done the rest of the body. Next, I go to the back. This is a great time to practice safe handling of your newborn. You're going to support the head and bottom and gently turn the baby onto its stomach, making sure the head is facing the side. This is a great time to practice tummy time and allow the newborn to gain control of their head and improve the curvatures in their spine. So just the same, you would wash, rinse, and pat dry the back. To turn the baby back over the same way, supporting the head and extremities, and gently turning the baby over onto its back. Lastly, before we go to the hair, we're going to change the baby's diaper using just water and a washcloth. Especially if the baby has had a circumcision, you would want to avoid any soap, lotion, alcohol wipes, or wipes with chemicals in them that could irritate the baby's skin. So just plain water and a washcloth is good for now. You would change the baby's diaper. Now we're gonna go on to washing the hair. Supporting the baby to remove this towel, leaving the clean towel underneath. and put the baby into a modified swaddle. And take the baby to the sink in a football hold. Using a very small amount of soap and warm water, you'd wash the baby's hair using the soft bristled toothbrush to gently wipe along its hair, removing any debris or fluid left from delivery. Ensuring to rinse the hair very well and get all the soap off. Then bring the baby back to its crib. Dry its hair while still maintaining good hold of its head. Now is a good time to make sure to put the hat on the baby so it can regulate its temperature again after being cold. Some things of physical assessment to look for in your baby during the bath are little amelia spots, which are little pimply-like bumps on the face and nose. Some other things to look for are caput and molding in the head, which is swelling during delivery. Those normally will go away shortly after birth. Your baby may have port wine, strawberry Mongolian spots, newborn rash is common, birthmarks. Some things to also look for are color of cyanosis or blue around the lower and upper extremities, around the hands and feet, and the mouth, which can indicate poor circulation and low oxygen status. I hope you've enjoyed this video and taken away a lot from it. I also hope you enjoy your first newborn bath. Thank you.